one of our amazing school nurses who I have worked with for 17 years. And a lot of people can learn school nursing, but few people can be as authentic at it as she is. It's a very diverse and complex role to be a school nurse that a lot of people don't understand. Her ability to coordinate the care for all of the kids with complex needs so that they are participating in school fully. Despite whatever health problem you may have, you can still be educated to your fullest ability and participate in everything, and I mean everything. We take kids regardless of their complexity of medical care on every event everybody else goes on. They're going to Disneyland, it doesn't matter. They're all part of it, and the case coordinator as a school nurse is making sure that all happens no matter what it takes.
She's just a wonderful person, and I'm so glad I had the opportunity to get trained by her, especially with our one student, Eduardo. When she started out with him in kindergarten, all the way now he's in junior high, and to make sure that his medical needs are met without interruption for his school day, so that he is participating. He has an adaptive PE teacher, he's getting awards at school, he's having a full, regular, productive day at school. And it has a lot to do with what Nurse Val and the other nurses, our district nurse Christine, have been able to implement here at school so that his medical needs can be met, for him to enjoy his school day with his friends.
This is Eddie Rodriguez Alba. He's one of the fantastic students here at WAMS, and he is one of the lucky patients that gets to work with Miss Val, and he has a few things he'd like to say to you.
I am being so lucky to have amazing people working with me, and Nurse Valerie is one of them. She always try to have everything ready for me to start school. She is really good at pushing people at my doctor's clinic to have all my orders ready to start. Nurse Val always have a smile on her face. She is very friendly and positive.
I am an advocate for students, and I do everything that it takes to get them not only through the school day, but get them as much access to everything, field trips, any kind of experiences that anybody else would get. It's going to be my job to communicate with the doctor, communicate with the parent, to make it all happen so that they get to experience and have access to everything. This includes making sure the staff is well trained and comfortable, because if they're comfortable, Eddie's going to be comfortable, and so is all the students. And so I just push in where I need to. And I've done it all. I've walked Eddie to the cafeteria and said, this is what Eddie needs on his plate, and he wants to be like everybody else, and that's what we're gonna do. I'm gonna call the doctor and say, how can we get Eddie to have a plate like everybody else? Something as simple like that, that means the world to someone like Eddie, to be able to have what everybody else is having on their plate for lunch.
My name is Eric Segura. I know Nurse Val when my first year of being diabetic. The first time that I met her, she was like so open to me, like, oh hi, I'm your new nurse. I'm like, okay. But the further I got to know her, the further that me and her got so close to each other, because she's so thoughtful to others and like so cheerful, and like by that she just made me feel so happy.
I think nursing is really a servant's job. We are not here for the glory. We are not here for the limelight. We're here to be servants. We're here to help others. And whether it's in a hospital or in a public health setting like I'm in, really the heart of nursing is to serve and to help and to heal. And sometimes that means physically, sometimes that means spiritually. I think nursing is a very holistic job, that we are teachers, we are social workers, we are doctor's assistants. So I just feel like nursing is a very holistic job that is really service-centered, helping-centered, and healing-centered.